Thanks for the welcome, everyone, and thank you so much for the introduction, Trish. Today, we will be discussing why bodies matter in patient and public engagement and embodied reflexivity. So I'd first like to start off by acknowledging that myself, Trish, CHI, are located on Treaty 1 land, home of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and homeland of the Métis Nation. And in coming together today to do this webinar, we respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past. We recognize the ongoing present-day colonial violence that is faced by Indigenous peoples within healthcare, education, justice, child welfare, and government systems. And we dedicate ourselves to moving forward in partnership in the spirit of reconciliation and collaboration. And in talking about patient and public engagement in health research, we always want to remind that Indigenous research methodologies are really at the forefront. Indigenous scholars, researchers, and communities are people we should be looking to. And we also believe that patient and public engagement must be grounded in social justice and health equity approach. So today, a quick look at our agenda. We're going to talk a little bit about critical reflexive practice and why it's important when we're doing engagement. We're going to talk about a little bit about the difference between discursive and embodied reflexivity. Don't worry if those words look scary, they're not. We'll go through them. What is embodied reflexivity and how do we incorporate it into engagement practice? So for those who have attended our previous talks, we've discussed the need for critical reflexive practice when it comes to public and patient engagement in health research. But for those who haven't had the chance to attend yet, what this means is that in order to build authentic and meaningful relationships with public and patient partners, which requires trust and understanding, it's essential for health researchers and patient partners to bring a level of self-awareness that may not have previously existed. So we're building and growing that level of awareness. So we're looking at having an understanding of how our own personal values and experiences and interests, beliefs, and political commitments shape the area of health we research, including what we choose to prioritize in our research, what questions we ask, the way we design our study, the methods we use, the way we interpret the findings, and the way in which we disseminate and implement the findings. And also it's about examining how these values and experiences relate to the social locations that we inhabit, that we personally inhabit. So things like our gender identity and expression, race, ethnicity, socioeconomic status, ability, age, sexual orientation, immigrant status, religion, as well as larger processes and systems of power and oppression. So things like colonialism, racism, patriarchy, capitalism, heterosexism, transphobia, and ableism. And it's really important as well for researchers to have a deeper understanding of their own individual connections to settler colonialism as well, before even embarking on any type of engagement of people with lived and living and understanding. Because in order to build trust and understanding with communities and partners, it really is important to have that critical reflexive practice and to facilitate so that it can facilitate questioning around policy and practices and research, both past and present, that are often used in things like the colonization of Indigenous peoples in Canada. So it's really important that a comprehensive strategy around patient and public involvement in health research begins with critical reflexive practice. It helps to transform the engagement process when both researchers and public and patient partners bring self-awareness about the assumptions or the truths in their work. Now, this is just an important little reminder before we proceed any further for some of our quantitative folks. If we do have any, I'm not sure if we have quantitative folks today, but some of our researchers in quantitative research, as well as people with lived and living experience who engage in work that is quantitative, We often think, when we think about critical reflexive practice, we think about qualitative research, but it's actually really important, especially when we're engaging people with lived and living experience, to practice critical reflexivity when it comes to quantitative research as well. And a really good quote, this is from Walter and Anderson, and they kind of touch on why it's so important. And so the quote is, they write, statistics are powerful persuaders. As systematically collected numerical facts, they do much more than summarize reality in numbers. They also interpret reality and influence the way we understand society. And the researchers who create statistics leave their mark on them, not just because people are biased in overt or conscious ways, but also because social, cultural, economic, and political perspectives infuse the research data, even when we think we are just counting people. So this is really important to consider as well. Of course, statistics are powerful persuaders. It's used by healthcare policymakers, decision makers, politicians to make decisions, but it does more than summarize reality. It also interprets reality in the way we understand. And researchers are human beings, right? Researchers who create statistics are humans, and they have their own biases informed by their social, cultural, economic, and political perspectives. And this influences the research data. So we're not just counting people. And population statistics really create, as Anderson and Walters talk about, create an accepted reality of things most of us think they're merely describing. And so everything from the social, cultural, economic phenomena that are chosen for inclusion in our research, and also those things that we choose to exclude from our research, provide a reflection of society's changing social, cultural, and economic priorities and norms. So it's really important to kind of think about that as well, that critical reflexive practice is not just for qualitative researchers or people with lived experience engaging in qualitative, but also quantitative. So it's all around an important thing to do. So reflexivity, what is it? It's the practice of continuous reflection by all members of the research team. So whether you're a researcher, a patient partner, a caregiver, a community member, a healthcare decision maker, regarding your own values, preconceptions, behaviors, recognizing the impact that that may have on research processes and the interpretation of findings. And reflexivity in research is really crucial because it's not only helps to kind of help you to deconstruct yourself, whether as a researcher, a person with lived experience, as well as an individual, but it also can impact the research team's relationships. So really exploring how that could impact the research team's relationships. And sometimes research teams may choose to do some exercises prior to engagement to ground the team. And we have some, I think we've talked about it before in the past, but we have some neat little tools and workbooks that can help research teams as they begin to do engagement and really think critically and reflexively around the research question they're asking. But also, a lot of times you'll see research teams journaling on a continuing basis. So using a journal as an opportunity to kind of reflect, to continue to be self-aware of our own social location and biases and perspectives, and how that may impact not only the decisions that we're making as a research team, but also our interactions with one another, including researchers and patient partners. So definitely it's something that you can do as a team together, as a team, each one of you individually kind of using a journaling to reflect after meetings, after you make a major decision, kind of just how things went, how my own social location may have influenced the way I reacted in a certain way, or the way, the decision that we were going towards or making. Oftentimes when we discuss critical reflexive practice, we're actually only talking about one part of the equation, and that's something called discursive reflexivity. And really what that is just the examination of how language and symbolism in relation to systems of power and oppression. And there is another component, though, that we don't necessarily talk about as much, and that's equally important when it comes to patient and public engagement, and that is embodied reflexivity, which we're going to dig into in a second. But first, just a few examples. I think we've already kind of touched on it, but just examples of what discursive would look like. So what are my own personal values? This is when you're looking at value systems and experiences and interests and beliefs and how that impacts the area that we're researching and the decisions we're making. Also thinking about how it's related to the social locations in which we inhabit and larger systems of power and oppression. We're also looking at how values and assumptions and perspectives with regard to people living with health issues in which we will be researching. So this is not only researchers thinking about what are some of their assumptions around people living with a health issue that we're researching, but also people with lived and living experiences as part of the research team, challenging yourself in understanding that your experience exists within a context of where you're socially located, right? And so that people may have different experiences than yourself, and constantly challenging yourself around that and questioning as well when you're involved in research decision making. So embodied reflexivity. This is actually where we're going to start looking at how our physical presence and performance can influence public and patient partners' sharing of their experiential knowledge, and in turn, the production of knowledge that we are working together to co-create. So this is actually getting into thinking about our own bodies, which is interesting because a lot of times in research, of course, we have that separation of mind and body, and we don't necessarily do that a lot. It's about looking at the materiality and the experiences of the body, the story of your own body as experienced by yourself. And oftentimes the way we think about our bodies is in terms of our possibilities for acting in the world, but embodied reflexivity takes it a little bit further at exploring our own physical manifestation in the world and how we physically come to interact with other people in our social interactions. So in this case, how we interact with other people on our team when we're engaging. And why is it so important when it comes to patient and public engagement? Like, why are we getting into this? My goodness, we just got into our values and perceptions and experiences, and now we're talking about our bodies. Like, what does that have to do? And I totally get you because I can understand, like, whoa, this is too much. But it's really good to think about these things because oftentimes the experiential knowledge of people with, patient, caregiver, public community partners, in order for them to share their experiential knowledge and to inform research decision making when it comes to patient-oriented research, it involves that ability to share your bodily experiences and interactions within the healthcare system. And so we're asking people with lived experience to really tell that story a bit about their bodies and that interaction and the environment. And so it's important for us to also understand how bodies and healthcare system and our own body and being self-aware in that way as well. Because really experiential knowledge can help to identify research priorities and clarify and refine research questions and help identify research outcomes, all of these types of things, and help in the co-design. So it's really important to understand the importance and the value of experiential knowledge, but also how it comes to be in our interactions. So sometimes, sometimes experiential knowledge is seen as a given whereby a body and world are presented in kind of this unmediated way. Uh, but what we don't always think about is how health and embodiment actually exist. And it travels through a filter or a lens of larger systems of power and oppression. So it's impacted by colonialism, racism, xenophobia, sexism, transphobia, ableism, classism, all of these different things, sizeism, saneism. So the concept of health is, and also we don't always think about it, but the concept of health can be used by systems to produce difference in society. So taking embodiments and bodily processes that are seen as attributed to a particular group and framing them as the other and making it into health issues or diseases. So one of the most easy ones is things like menstruation or childbirth, and those things are medicalized and seen seen in a different way. We also know from some of the folks that we engage in the transgender community, the idea that in order to access gender confirming surgery and have it covered by public health funding, you must first be diagnosed or labeled as having a mental health issue, so gender identity disorder, before you can access this necessary surgery. So understanding how health and how our bodies can sometimes be framed by systems of power in ways medicalized and pathologized to reinforce difference. And also the idea that health can sometimes be used to conflate diseases with certain groups of people who in health research and public health are conveyed as at-risk groups in order for systems of power and oppression to justify further surveillance or disciplining or othering of bodies. So thinking about, when we think about things like type 2 diabetes within certain populations, articulating it as having higher prevalence, but at the same time not exploring the impact of settler colonial systems on the health and well-being of people. So really having a deeper understanding of that. So in order for people with lived and living experience on research teams to be able to share their experiential knowledge, there needs to be an acknowledgement of how medicine and health research can sometimes work together to perpetuate things like white supremacist, patriarchal, capitalist, ableist systems of power, and the effects this may have on an individual's story about their body and the narratives around embodiments and sense of self. So we need to understand that the stories of our bodies are mediated through not only our social location, and it's not only about understanding the materiality of our bodies, but also the sociality of health and embodiment in order to be truly innovative and address health inequities in our research. So embodied reflexivity means discovering how our physical presence and performance can be involved in the construction of particular narratives. So thinking about how we think, communicate, and experience our bodies, and that relationship to other social institutions, including media, government, medicine, education, and laws. And thinking about how that is inscribed on the body or re-inscribed on the body to other people, and to deem some bodies as worthy and some as unworthy. So really thinking about examples of how laws and policies and governments and media and institutions shape the dialogue around everything from, for example, within disability, the bodies of people living with disabilities are often within healthcare systems medicalized and viewed in terms of failing bodies in need of fixing. But within the social model of disability, we push back on these assumptions, stating that people are disabled by barriers in society and not by their impairment or difference. And in the CRIP movement, adding to this model of disability by addressing the materiality of the body, and that for some, living with a disability may mean interactions with medical systems. Thinking about gendered bodies, thinking about challenges around the naturalness in which bodies are framed in clinical and biomedical research, and thinking about things like performative gender and so on, as well as really thinking about racialized bodies as spaces where violence can occur with impunity. So thinking about research, researchers in Canada have to think about and have an understanding of the history of residential schooling in Indian hospitals and TB sanatoriums and forced sterilization, all of these things, and challenging any type of deficit-based focused research that seeks to pathologize or medicalize, and instead looking at strengths-based and resiliency-based lens from there. And it's also important to think about the context in which stories about the body are shared. And so this includes when people disclose experiences of their personal physical interactions with their environment. What we may not realize is that in imparting this knowledge, the context in which it's occurring, there is a level of vulnerability, and we may not realize our own physical presence in relation to the storytelling and what that may reincorporate within power relations. So research shows that trust is built between two people through an incremental and mutual sharing of vulnerabilities. And this means addressing the sometimes silent ways in which our bodies can kind of almost be imbued with power and privilege when we're interacting with one another. So some ways in which bodies may silently impose power, we always talk about, or people joke about the man spread or things like that, where we have gendered interactions with one another and how we move our bodies, but thinking about and bringing to light. So really when you're doing engagement, journaling, and thinking about how your bodily presence, some of the silences that are there that may impact the ways in which we interact with one another. And we don't typically ask researchers to think about the impact and the experiences of their own bodies. However, knowledge and experiences, including those that are cultural, social, emotional, are often lived through the body. So to build these trusting relationships, this means researchers must also hold themselves accountable for how their bodies impact sharing of these experiences and the knowledge they impart. So it's really important for researchers to examine bodily experiences that are outcomes of exchanges that they may have with other research team members, including patient and public partners and themselves. So sometimes after an engagement activity, you'll find, oh my goodness, there's a bodily sense of like fatigue. And it could be tied to underlying emotional state of the researcher after bearing witness to a story that involves some trauma. And oftentimes I think researchers and even people with lived and living experience might be just like, I'm just tired, and move on and try to tackle another task. But it's really starting to reflect on what your body is telling you and how you can install self-care in there as well, right? Maybe your body's telling you you're tired because it was a pretty emotional exchange and we really did a lot in that conversation and in that engagement. So maybe I need to listen to my body and also take a step back and take a little bit of a break. That's actually why when we engage, a lot of times we talk at the end of our sessions, we talk about naming one good thing you're going to do for yourself tonight as a piece of self-care. And that is just to really recenter that it's okay after having, you know, a tough engagement or stories, and it's okay to listen to your body as well and how it interacts with one another. And so in being more conscious of this kind of reciprocal exchange of bodily experiences, an empathic connection can be formed, which is really foundational in creating that trust. So affect and physicality can help us to understand the realities of oneself and another, and become the entry point to kind of deeper insights in the lived reality of others. And emotions, oops, and emotions can provide significant feedback and knowledge about the environment in which people are situated. Emotions are embodied experiences that can reveal how bodies are entwined with the experiences of others. For example, say a researcher starts feeling really angry as a caregiver or patient partner recounts a really frustrating experience within the healthcare system. These emotions and reactions within the body are a result of really being present and actually listening to a partner's story and lived experience. And the researcher's response, even physically, really helps to validate and acknowledge the disappointment or the exasperation that a partner might feel as they're talking about things. And this demonstrates how emotions are not just an individual phenomenon, but exist as within a relationship between people, and the way in which researchers use their voice, how they make themselves present when they're having these conversations and when people are sharing their stories, and also even stuff from, you know, where you sit in proximity to the partner as they're telling this. These are all significant aspects of the engagement process and can really impact the way in which the relationship evolves and whether people feel comfortable enough to share their experiential knowledge with you. And of course, it's all about acknowledging how nonverbal communication can contribute to the co-construction of knowledge. So things like body memory, so perhaps practice or performance that has been embedded within your physicality. So for example, if you're a clinical researcher, a nurse, or a social worker, there may be certain nonverbal displays and emotion in relation to a story that's being shared by people with lived and living experience that you might not even realize. But because of your lived experience in your profession, that just comes out in your physical interaction as well. And it's also important to recognize that our identities are multiple and complex, whether we are a researcher, a public and patient partner. We all carry and embody kind of a complex history of lived experiences and identities that are inseparable. So in being a truly embodied researcher, it's important to challenge the illusion of this value-free, objective, and safe approach to research, as well as the notion that one is simply a researcher within a field. It's important to realize you are part of the engagement process, and this is a relationship that's being built. And appreciating how socially constructed differences can impact on the interactions between researchers and public and patient partners. So there are moments when a researcher is confronted by their body in ways that draw attention to how differences are constructed and lived, whether it's thinking about things like privilege and whiteness, culture, religion, our age, even the space that we occupy with our body. These are all kind of moments where we realize how that might impact the storytelling that's going on. And it's something a lot of times, so we can't avoid. We need to understand how our social positioning exists. And when researchers understand how their social location is inscribed upon the materiality of their bodies and the influences of their bodily performance, they can begin to collaboratively challenge all of these things that we've talked about, so the social construction of difference. So the big one is the body discloses. So embodied research means reflecting on the very presence of both us as a researcher, or whether we're a patient or caregiver or community partner in the research process. So in our conversations and our engagement, oftentimes there's kind of an erasure of the researchers' bodies from conventional accounts of public and patient engagement in health research. That kind of negates and obscures the complexities of working together and knowledge production, and yields a very kind of deceptive and tidy account of involvement. We sometimes don't really talk about all of those embodied silences that can impact the way we interact and make decisions. And also just reflecting upon bodily presence and interactions means really addressing the elephant in the room. So beginning to examine those silences and omissions in the research process, we can begin to critically examine how bodies are often can be implied in different ways. It's important to address the role of silence, of secrecy, and our mission in public and patient engagement around all of these different aspects. And in each research encounter, we need to think about how silence and what's not said might inform or restrain or facilitate the decisions that we make moving forward. So it's a lot of things to think about. I always go through a lot of stuff, but maybe let's take a break and have, if there's questions or if there's thoughts about, or even just about how you, whether as a researcher or as a patient partner, think about your body and have that awareness when you are doing engagement. You can write in the chat box.
We have a question in the chat from Saint asking, would you also recommend patient and public partners to reflect on embodied reflexivity?
Yes, absolutely, Saint. I think it's really important for all of us to think about it, because it really kind of challenges, even on patient public partner side of things, thinking about how our experience and the context in which we're sharing our experiential knowledge with someone else, I think is super important as well, especially when we're trying to be inclusive and have diverse perspectives around the table. It's really important for all members of the team, even I would say healthcare decision makers and clinicians, everybody who's around the research table. I would encourage to have those, to think through it and really reflect on those things.
I think your camera got squished down.
Oh,
you can see your keyboard. There you are.
It's I'm back in the office for the first day. Still navigating it.
And anyone who you have the ability to unmute yourselves if you want to ask a question or make a comment directly to Carolyn. I think that's so interesting, though, especially in our own engagement activities too, considering how we navigate the world and how we navigate our relationships.
Yeah.
Patricia says, something I've started using at some points in research projects is a feelings wheel. Oh, I think I might know what that is.
I like that idea. Did you want to talk about that a little bit, Patty? Did you want to share?
Yeah, so it wasn't so much in the public engagement part, but it was actually presenting the public engagement part to clinicians. So they had made a video, and the first thing, we wanted to start with voice, not with ours.
Yeah.
Because we wanted to bring them into here's why we're doing this, type of a thing. And we actually then invited them to, the feelings wheel has like really core, like basic descriptions of feelings. In the center, it's got like 8, and then you get more nuance. So first locate where you are, and then find your words. And we actually got them to share them in an anonymous, like whiteboard kind of situation. So we found that as a really good way to actually, a bit to evaluate, because we expected that that video would throw people off into a place of discomfort, which pedagogically it was designed, like that was the goal of the workshop, but then also as a way we used it at the end. So I could imagine using this in other times, right? And particularly, I think of, depending on the type of engagement you're doing, it could be anonymous again as a way to tap in to how people are feeling when they're leaving. And one other thing, I'm not pretending to be an expert in this, I'm not, but one other thing we actually have started doing at breaks is putting up, we're going to do this, yeah, we're going to continue doing this. It's actually little breathing visualizations. So depending on what people are doing in their breaks, or if they're back for a couple minutes early, it's like a chance to like come and be present in this place, which isn't quite embodied reflexivity, but it is embodied, I think, participation, maybe is a way to think about it. So yeah, but I thinking about this more and more, right? Like how to use the body as a way to understand what's happening in the moment. So thank you for this. Yeah.
Oh, that's a wonderful suggestion. I love the idea of grounding within meetings to have that kind of breathing exercise, because that is acknowledging the body in your engagement, right? And not just leaving it out or having it just as one person sharing their experiential knowledge, but that we all inhabit bodies. So those are great suggestions. And I love the wheel as well. I can definitely see how you would use that in some of your engagement as well. Oh, there's a 10-minute video as well.
Well, that one is, I just found the 1 minute quickly, but there's a whole 10-minute one, which is nice for breaks, right? Depending on what people are doing. Or if you just want to give people a few minutes to reflect on something and then you're coming back. You can hear that I'm doing all of this online. Essentially, like that's where my engagement has been happening thanks to COVID. So yeah.
And that's like that additional difficult layer of the online piece as well, and physical presence. How do we demonstrate physical presence when we're online? And it's hard to sometimes to read one another as well in our interactions. So that's definitely added that kind of layer, but that's a wonderful idea. I like that. Thanks so much for sharing, Patty. Were there other questions? Oh, Sarah.
Hi, Carolyn. Just something that you said on that last bit, like in communicating over Zoom and things like that, sparked a memory on another thing that kind of relates to the topic of bodies here, which was I can't recall what the study was, but it was noted that when like women take up 30% or something like that of the room, men will perceive them to be equally represented. And also that often when in meetings or other settings where people are speaking up, if a woman is speaking up to the same extent that a man is, she will be perceived as taking over the conversation versus, and then often that will also result in women speaking less in a meeting if men are taking charge because they are afraid of coming off as aggressive. So I've seen a few different things on that kind of point. And I mean, of course, it resonated with me as a woman who went through engineering, which was highly male dominated. But that was just something that I thought was sort of relevant to the discussion today.
Definitely. Those are really valuable insights in thinking about gendered bodies and how we are and our presence. I like that you were saying like 30% of our presence means that, yeah, and even just how we take up space. and how it's perceived and how it actually affects the way we engage, right? That's fascinating. Thanks for sharing that, Sarah. Were there other people who may have had?
I just wanted to comment, this makes me think too about when, in considering going back to some in-person engagement or just reflecting on previous engagement in person, like how we set up the room. You know, do we put tables in a circle? Do we have a classroom style? How are people seated? Who's seated next to whom? And you know, even things like, I remember we had to find a chair without wheels on because someone had a neurological condition that were, you know, had a balance component to it, and just things you wouldn't think about inhabiting your, you know, as myself, a able-bodied person without that kind of condition, like just things you don't even think about. So it just, I think, really speaks to the importance of embodied reflexivity. I wonder if you can, like, how should people get started on embodied reflexivity? What's the first step somebody should take?
You always ask the good questions. Practical. I think I think a lot of it involves kind of, first of all, thinking, doing some critical reflexive practice probably on your own first, and doing a little bit of journaling to understand all of the different things that may affect the way you engage with other people, and how your physical presence may be seen. Sometimes you can even have conversations with a close research team member as well, and talk about like how you present yourself or how you interact. Are there things that I'm unaware of? Like, do I have things that I do that I need to be more aware of as I proceed? And I think it's really important to think about those kinds and have those conversations as well. And as a group, having conversations about embodiment as well. I think we had some of those, now I'm thinking about some of those questions that we had around physical presence and safety, and really having those conversations around how to be more present when we are together, when we are talking with one another, and being able to really challenge one another when we're not feeling as safe.
Like having the conversation, if you're doing like a group activity with partners, talking at the beginning about those not ground rules, guiding principles, I think is what we call them with our collaborative partnership. And what does safety look like to you, feel like to you? And that gets into the physical feelings as well, right?
Yeah, when we interact, we do things sometimes that we don't even think about, like eye rolling or arm cross, or like just things viscerally attack us. And having those on, I think also after each meeting, taking some time to think about how you felt during certain conversations, if something brought up a feeling within your body, and whether that may have had an impact on somebody as they were telling a story. Maybe you displayed something as you were communicating, and then thinking through those things. So taking time, building time after your meetings to actually just have some quiet time to reflect on that and write it out, or however you enjoy doing it, maybe like taping it, or like things that you may enjoy to kind of think about those things.
I wonder too, in reflecting, because sometimes we see someone else do something and we may interpret it in from our own perspective and in our own context, not recognizing that it might be something completely, that we don't understand, that we're not privy to something that is causing them to do that behavior, like anxious movement or yawning, or like it does, yawning doesn't mean someone doesn't think you're interesting. They might just, have been up all night with their toddler or something, right?
Exactly. And not jumping to those conclusions, right? Automatically. I know we've had, even in safety conversations before, conversations around cultural differences and things like eye contact, that if someone's not making eye contact with you, it doesn't necessarily mean a sign of disrespect. Like that, some cultures, it is a sign of respect not to make eye. So having those conversations out front as a continuing dialogue, like, really helps when we are interacting, so that we don't necessarily jump to conclusions. I have a nervous laugh, which I know sometimes can affect engagement processes as well. And being more aware of that is always a good thing for me.
Yeah, I think it underlines the importance of talking about it and thinking about it.
Yeah.
I don't know if there are any other comments or questions. Feel free. You pop them in the chat or unmute yourself. I think you've given us a lot to think about and work on. I love this topic. I'm so excited to incorporate it more into everything we do.
And there's still so much I think there's still so much that keeps coming out. And I'm so excited to see, like, when people start to do that type of reflexivity and involve it when they're talking about their engagement approach afterwards, if you're publishing a manuscript, really talking about how did we address these things and how did we make sure that everyone on the team continue to be critically reflexive. How did we understand embodiment within our team? But that could be a weird nerd thing of my own that I like, but it would be exciting.
For those of us that could imagine doing that, though, one of the things I wondered if you could share were the references you're pulling on for embodied critical reflexivity.
Absolutely. That's one thing that we can send out to all of our attendees today, is I can send some kind of neat references that you can start taking a look at and kind of comb through to help think through these things as you journey through it. For sure. And Trish
I will send out, I'll send out the slides and a link to the recording to everyone who registered. Sarah?
Yeah, I just wanted to say, like, thanks. And it also this discussion made me think about how when you're reflecting on your body and how it impacts others, how there's kind of two sides to it, both your subconscious, how you use your body, like you said, that, like, the man spreading, I don't know that men do it on purpose, but it absolutely impacts how people feel. But then also how there's things that you have no control over, like a really big dude with a big bushy beard can be viewed as an intimidating presence, even if they aren't intending to be that way at all.
Absolutely. Yeah, it's the silent, like the embodied silences, like the things that we don't typically think about, but that have an effect on our engagement. And the more we start kind of thinking about, oh, so maybe when I'm having this conversation, people are perceiving me this way. And like, maybe that's why people weren't really interested in sharing, or like maybe the way I was moved, like just thinking those pieces through are so important. Those different levels.
Well, exactly. And whether it's a level of something that you're doing subconsciously, or if it's something that's subconscious in the other person, but being aware of it either way.
Absolutely.
Thanks again.
Thanks, Sarah.